Alzheimer's disease is the sixth leading cause of death in the United States. About 5 million people suffer from it. But it's not just the patients who end up feeling the effects of the disease. Alzheimer's often takes its toll on the caregiver as well. Here's more.
That is Jake.
Jake, right. You know who everything is.
Okay.
Caring for a person with Alzheimer's disease at home is a difficult task and can become overwhelming at times.
Alzheimer's disease is a very challenging disease emotionally, causing a lot of stress and burden. Physically, having to care for the physical needs of the person, and also financially.
Each day brings new challenges as the caregiver copes with changing levels of ability and new patterns of behavior.
As a result, there's kind of a wear and tear as the caregiver takes on more and more responsibility. And they often let themselves get to the point of being so maxed out before they actually seek help.
According to the Alzheimer's Association, roughly 10 million family members, friends, and neighbors across the U.S. are providing unpaid care for a person with Alzheimer's disease. Last year, 8.5 billion hours were devoted to such care, estimated to be worth $89 billion.
Families often try to cope on their own. They really want to take care of the person at home. They feel a responsibility. They feel a great love.
Cordula Dick Mulkey of the Alzheimer's Family Services Center in Southern California knows caregivers don't have to go it alone, and she's made it her job to ensure that they don't.
What we can do is we can educate the caregiver about the progression of the disease, about the tools. We can get them into support group where they can get emotional support.
Support healthcare experts say is critical. According to statistics, unpaid family members or caregivers are 40% more likely to suffer from depression and other health problems than non-caregivers. The key to caregiving, experts say, don't wait for a crisis before seeking help.
Finally, the caregiver reaches out, but by that time, the person's progressed and the situation is so complex that we can't do as much as if people started early.
And if you'd like to find out what kind of help is out there in your area, we have a couple of websites that'll help get you started. The first one is www.alz.org, or you can also go to www.caregiver.org. Nancy?
When you think health, think IRU.